Brooklyn Independent Television.
Hello and welcome to Brooklyn Elected Official. I'm New York City Councilmember Dr. Matheiu Eugene, and today I'm joined by Dr. Donna-Marie Manasseh, who serves as the Director of the Breast Cancer Program at Maimonides Medical Center. Welcome, Dr. Manasseh.
Thank you so much. Thank you for having me.
Oh, it's a pleasure. And let me first and foremost thank you for taking time from your busy, very, very busy schedule to come over here, because I know as a surgeon, you have a lot on your plate.
I definitely have a lot on my plate, but I think promoting awareness is one of the main jobs that I have and I enjoy tremendously.
I like that because I think awareness and prevention is the best medicine. And it is very important. We will make a difference, you know, in the quality of health. We will make a difference in this community, in New York and Brooklyn, when we promote prevention and also awareness to the people.
I agree. I absolutely agree with that.
So before we start, could you please tell us about yourself?
Well, I actually am new to Maimonides. I actually was at Stanford Hospital before, running the breast center there. And what attracted me about Maimonides is that Maimonides Breast Center is actually the only breast center in Brooklyn, the only dedicated breast center, a breast center imaging of excellence. The great part about it is next to the state-of-the-art technology, they have all the top-of-the-line, cutting-edge things that we use to diagnose women early, to the staff, to the physicians who have been trained in some of the best institutions across the country. And they're all just in the backyard of Brooklyn. You know, just basically people that take care of their own and give you the comfort environment of feeling safe.
You know, Maimonides is one of the very important medical asset in Brooklyn and New York. And I remember when they created the Cancer Center.
Yes. And
I was one of the advocates for that, supporter of this very important center, because it is very important for Brooklyn and for New York to have an institution at Maimonides Medical Center. And I'm so pleased to have you on the show.
Thank you so much. Thank you so much.
And let me ask you one thing. You are going to talk about breast cancer.
Yes.
And we know breast is such an important organ.
Yes.
Can you talk about the structures within the breast before we go there, for the viewer to understand exactly what we're going to talk about? We know the structure, there are veins, arteries, and
sure.
Can you briefly
give
some detail about this very important organ?
Yeah. The anatomy is my favorite part. That's part of why I'm a surgeon, so I love talking about the breast. Essentially, simply put, the breast consists of a couple of different structures that are really important. What we call the lobules, which is what we call where the milk gets produced. So a woman's going to nurse baby. That's where your milk production begins. And the milk travels out to the nipple through a kind of a tube, which we call a duct. The rest of the breast consists of fatty tissue, some blood vessels, some lymphatics. And it's really the lobules and the ducts where most of cancer action, if you will, occurs. Women can get cancers that develop in the duct and in the lobule. And that's where cancer will start. With some time and some changes in the environment, these cells learn the ability to break out of those structures and enter into the rest of the body potentially. And that's why when we talk about awareness is so important, because it doesn't always happen right away. There is a time period where it's just confined to the duct or confined to the lobule, and we can treat and cure at that point. Similarly, even when it just breaks out of the duct, it can be small enough where it's still a very treatable and curable situation.
Is there any difference between the breast of the young person and the breast of an adult?
Yeah.
And tell me, you know, the reason I'm asking that for the sake of the issue that we are going to discuss.
Yeah, there absolutely is, and most people can see that from an external. If you look at your body, when girls are growing up, in the beginning they don't come out with full breasts.
I'm talking about in terms of the anatomy and the pathophysiology of
the breast development with respect to hormones, estrogen. As a woman grows, there's more estrogen in the body, and that causes effects on the breast tissue, causes the changes and developments of lobules and ductules. And similarly, as a woman gets older and there's less estrogen around, those breast structures tend to kind of regress. So you don't see that as much. So there's definitely changes going on in the breast, pretty much with respect to the hormonal patterns as a woman changes in her age.
So that means, is there any relationship between the age of the young people and the adult in terms of breast cancer?
There is. As women get older, our risk for breast cancer actually increases. With that said, most of our breast cancers that we see happen in older individuals. That's why we actually do mammograms in older individuals. What's happened, though, is that we do sometimes get some patients with breast cancer developing at a younger age. Sometimes that's related to family history reasons, genetic reasons, and just environmental reasons. And that's why it's actually even more important to increase awareness about this disease, because oftentimes, unfortunately, because we think it's an older woman's disease or something that you'll get when you're older, a young woman that presents with a lump, some people will think that it's just something that's not a cancer, and it actually sometimes can be. So it's important to be aware of your body, aware of what can happen, so that if something does happen, even though it may be unusual, it gets attention immediately.
Since you start talking about that, let me ask you, can you talk about the different factors, the risk factors, related to breast cancers?
Sure.
In terms of, genetic and also gender, not gender because we know that, I'm glad to say gender because some of the time people believe that only women
that's right.
have breast cancer.
Absolutely right.
I'm going to talk about that later on.
It's a good point.
But talk about the risk factors,
sure.
please.
So some of them you actually mentioned, the risk factors for breast cancer. Gender is actually one. Being a woman increases your risk compared to a male. And like you said, men do get breast cancer, but not as frequently as women do. Other things that include having a family history. If you've had members in your family with breast cancer, that can also increase your risk. Some other factors that we talk about that are somewhat changeable, somewhat not changeable. The age you have your first child. We usually talk about if you have a child after age 30, you have a little bit of an elevated risk. If you when you started having your period, when you finished having your period, those interval times, if it's younger, when you started having your period, you have a longer period of time that estrogen is exposed. So those are some of the risk factors we talk about. Also, if you've had some radiation treatment for another disease in the chest area, that can also increase your risk. But the important things about risk factors is to know that they're there and they can affect your risk, but it doesn't necessarily mean that you're absolutely going to get breast cancer. Nor does not having the risk mean that you will never get breast cancer. So I think when I look at risk factors, I look at them as just information that we also use to know where's the best place to put this person in terms of her surveillance. Do we need to ramp up the surveillance a little bit, or do we need to just do what we usually would do for the average woman?
Does pregnancy make a difference in terms of the risk factor for women? I mean, there are women who give birth to children and women who never give birth to children. Is there any difference, in terms of risks for those two categories of women?
There is a difference between those categories. We do consider not having children as a risk factor. Again, if you think about the physiology behind it, it's what the breast is being exposed. When a woman goes through pregnancy and delivers a child, there's changes in the hormonal that also affect the breast. And women who've had children will know this, that the breast actually changes in preparation to nurse the child. Those changes can sometimes be protective in terms of developing breast cancer. But that's why we consider it less of a risk if you've had children, particularly before the age of 30.
But we know also as the human being age, there's a change in the body in terms of the hormonal change, endocrinologic, could you talk about the difference between the breast cancer in old person and younger person, or specifically in terms of the hormonal secretion? When the women, for example, have a change in the secretion of the hormone, the testosterone, or in the rest, is there any difference in terms of risk factors? Are they more prone to breast cancer, or it doesn't make any difference?
With respect to hormonal factors, as you get older, there's actually less estrogen around, but our risk for breast cancer increases with age, and some of that may be due to just the physiology of getting older. But some of the tumors that we may see in older populations tend to actually respond to hormones, so we can use certain medications with respect to that. In the younger population, some women haven't had children by the time they get diagnosed, or they have children later. The hormonal changes, the estrogen is still obviously around. So with respect to overall breast cancer development, as we get older, the risk for breast cancer increases. And it's probably a combination of factors. We really can't say one particular thing causes breast cancer. I think it's a combination of different factors that can affect, including age.
What about the symptom and the sign?
Symptoms and signs, one of my favorite topics, because unfortunately a long time ago, a lot of people used to say that if you feel a lump, that, you know, that's breast cancer. If it doesn't hurt, then it's not breast cancer. So I'm very particular about symptoms and signs, and I can give you a litany of symptoms, such as if you feel a mass in the breast, that you have never felt before, if you notice a change in the skin that you have never seen before, or if the nipple, some women who their nipples stick out, or what we call everted, if they invert all of a sudden, those are some of the changes we look for. But the thing I always tell my patients and the women that I speak to is any change you notice. If you're used to seeing your breasts, you take a shower, whatever you do, even if you don't necessarily do a monthly self-breast exam, you know that what they usually generally feel like, what they generally look like. If you notice any kind of change at all, be suspicious, talk to your doctor, and get someone to take a look and tell you that it's something benign or not. Worst case scenario, you spend some time in the doctor's office and they tell you something good, okay? But any change in the exam is what we really are looking for. If you are somebody who examines yourself every month, you'll be more familiar with your breast exam, and that actually is helpful, because some people are lumpy, and that's okay. But if there's a change is what we're really looking for, and those changes with respect to breast cancer don't just always have to be a lump. Sometimes it can just be a change in the skin or something that they see.
When you mention change in the skin, are you talking about the color change or structure? Can you give more detail about that for me? Because it is so important.
Yeah, it is very important. You're right. With respect to the skin, there can be a color change. So some women who've had breast infections will notice that the breast looks really, really red. Sometimes the breast can do that when there's also a cancer there. And so if they notice that their breast is really red, most people will see their doctor because they think it's an infection. But if it's not going away with antibiotics, we need to explore it a little bit further. In addition to that, sometimes it's not a change in redness, but the skin gets thick or dimples when you do certain maneuvers. Raise your arms above your head, or if you put your arms at your side and you notice there's a dimpling in the skin in a particular area that you didn't see before, those are all skin changes that we get concerned about. There can be some benign reasons for those changes, non-cancer reasons, but generally we want to make sure of that instead of just assuming that.
Is there any link between the diet, between the environment, and the profession with respect to the breast cancer?
I definitely believe there's a relation. Breast cancer is a type of disease that yet we do not know the exact single cause, and I don't really think we can think of it as a single cause. I think it's a combination of what's going on in your environment. Green leafy vegetables, things that have antioxidants, so things that will fight cancer cells, if you will, blueberries, the berries type of diets, the things, as they say, that you find around the circumference of a supermarket, rather right in the middle of a supermarket. Those are the better things for you to eat. Less red meat, low-fat type diets. Interestingly, the same things you would do for keeping a good cardiac health, good heart health. Those are the same things that you probably want to do for cancer as well. I think nutrition is really important, not only to prevent cancer or to make sure that you're overall healthy, but also if you happen to get a cancer diagnosis, I think there's still tremendous benefits from nutrition, particularly eating well with leafy vegetables, things that I always call pretty colors. In addition to that, I think exercise is always very, very helpful. We often recommend that a person undergo 30 minutes of exercise a day for 5 days a week, or for 7 if they're comfortable doing that, and make it part of their routine, because exercise helps build your immune system as well. All those things come together to help make a healthier environment, so that if something does develop, we either have an easier fight because the body's prepared to fight it, or, God willing, something else doesn't develop.
You spoke about the sign, the change in the breast in terms of skin and other structure, but could you give more detail about the symptoms? Any symptom?
The good and bad part of it is that when it comes to symptoms, luckily today, because we have such great technology with respect to mammograms and screening, that we luckily find this disease mostly without anybody having any symptoms. So most women, their breast exam's completely fine. There's no changes. I don't find anything on exam. They don't feel anything on exam. They do their annual mammogram, and we see a small spot on the mammogram, and it ends up being a cancer. So that's why we can't rely just on physical exam, either by your physician or by the person themselves. We also rely on the technology, and we have tremendous amount of technology at the Maimonides Breast Center. Pretty much mammograms used to be the standard and still is the gold standard on many levels, but we've evolved to include many other types of technologies: ultrasound, MRI. We have a 3T MRI, which is really, really sensitive at picking up really, really small diseases. And so it's important that technology has kind of come together with the surgical side, if you will, to kind of meld into finding this disease as early as possible.
In terms of mammogram, it seems there's a controversy in terms of mammogram. Certain experts say yes, they have to do mammogram. The women have to do mammogram every year. What is your opinion on that?
How long do we have? Okay. So mammograms, the easiest way I can put that, yes, you're right. There's a lot of controversy about mammograms. And the controversy really centers around, I think, more of looking at the entire population. When we're looking at a benefit from a test, we want to look at what's the benefit to the population. And I always ask the question, what's the benefit to the individual? If you think about it, if we eliminated the mammogram, we're basically sending ourselves back to the era when there was no mammogram, where a woman would feel a lump, go into a doctor's office, and then we would discover that she has a breast cancer. With mammograms, we have definitely seen, number one, that breast cancers present as much smaller disease, because we can't feel these in an exam, and the only thing that can potentially pick it up is some kind of imaging technology, usually the mammogram. And if we pick it up smaller, as I like to say, it's easier to treat a lizard than it is to treat a dragon, right? So if we pick it up smaller, it's easier to treat, curable result. So with mammograms, if we go with the controversy of, you know what, we shouldn't do mammograms because it's too costly to get saved possibly one life, if you will, in 1,000, what's the benefit to doing that? But you have to look at the individual person. We really don't have any other screening method of picking up this disease very early. If we come up with something in the future, then maybe we'll reconsider whether mammogram is the right thing for this time. But right now, we don't have any other screening tool that really can pick this up disease before my hands can.
Okay. Very good. You know, and we know that cosmetic surgery,
yes,
is something that, you know, very popular, and certain women that go to, you know, for cosmetic surgery to change the form and the appearance of the breast. What can you say about that? Is it something dangerous in terms of the substance used, in terms of the surgery? What is the risk? Is there any risk, additional risk, you know, related to cosmetic surgery of the breast?
Well, with cosmetic surgery of the breast, most women are doing that to augment their breasts, or particularly after they've had children, the breast has changed so much that they would want to improve the cosmetics. The risk associated with that is very minimal to none at all. In particular, because the plastic surgeons make a point to put the implant behind the muscle, which is really technically behind the breast as well. So previously we used to put the implants in the breast tissue itself. So one of the concerns was that maybe when they did the mammogram, we wouldn't see some of the breast tissue because it was being blocked by the implant. But today that's very rarely done. Really, really good plastic surgeons, and most will put the implant behind the muscle. So based on the fact that tissue is forward, the imaging can be performed so you can see what you need to see. And the radiologists are also very good with manipulating the breast around the implant to get a good view of the breast tissue itself.
What about in terms of the substance, you know, like silicone use? I remember that there was a big debate about the use of silicone, you know, when they do screening or exam, they find out silicone goes to the body, to other part of the body. What is your thought on that? There
was a tremendous controversy with that a couple of decades ago, and we found through extensive literature and studies that actually the silicone does not have that effect. And even despite what the research has shown, the companies have changed the way the silicone is produced. It's much more of a gummy bear type substance, if you will, where even if this implant were to disrupt or get ruptured, the silicone wouldn't leak out the way it would before. So despite the fact that we think there really is very minimal involvement with silicone going elsewhere once it ruptures, the companies have made adjustments anyway to allow for it not to do that. So silicone is considered safe.
Now let's talk about the men.
Sure.
Breast cancer, because people believe that men don't have breast cancer also. What can you say about the structure of the breast in men and versus the women?
So male breast cancer, actually, as we said, is not very common, but still can happen. The structure of the male breast does not have lobules the way a woman does, so most of their cancers are confined to the duct. I think the big point about male breast cancer, that even though it may not be a very common disease, it still happens. And I think that if someone, whether it's the person's spouse or if it's the individual themselves, feel a lump on their chest, it needs to be inspected immediately. Because unfortunately, the reason why males don't necessarily do as well as women when it comes to breast cancer is because we tend to dismiss it more quickly. They tend to think it's not something that could never be breast cancer. So they tend to get diagnosed at a later stage because we've waited. So I think just the same type of vigilance that women sometimes have when it comes to breast cancer, I think that they need to, if they notice a change on their exam, it needs to be evaluated. Because if a male is diagnosed at the same stage as a woman, they'll do just as well. But it's a matter of getting them in the office to do that.
I see. But is it true that the cancer, the breast cancer in men, is more aggressive and more dangerous than women. Is it true?
Not necessarily.
Or it is just a rumor?
It's not actually a rumor. It's just that it depends on the stage it's diagnosed. So a male diagnosed at stage 1 does just as well as a woman diagnosed at stage 1, a postmenopausal woman, someone who's after menopause. However, the problem is that, in general, men don't necessarily think that there's anything wrong. There tend to be a lot of supermen in my life, by the way, but which is good.
You're right, you can say it
which
again.
Which is good, a lot of supermen. And so when they feel something, they just kind of say it's not a big deal. And breast cancer is the last thing that crosses their mind. So by the time they get to a physician, whereas a woman would have gone, within the first couple of days of feeling something, by the time a male gets, it's been a couple of months, the tumor's had a chance to grow. So unfortunately they present later, which is why we end up having, unfortunately, a poor prognosis with male breast cancer, not necessarily because of the cancer itself, but timing of when the actual diagnosis is made.
What about the treatment, for breast cancer in men and breast cancer in women? Is it a different procedure? And we are not going to the surgery now, but in terms of treatment.
Yeah, some aspects are
because
different.
Because the body of the men and women are different in terms of hormone and, and the rest.
With respect to chemotherapy, it's generally the same, but with respect to hormonal therapy, there can be some differences. With respect to surgery, women, we try to do breast conservation if that's their preference. But with men, that's not so much a priority because there is so little breast tissue there. So there's some subtle differences between the two.
Now let's go to the surgery.
Yes.
This is your area. Could you talk about different techniques used in terms of breast surgery?
Well, this is one of the most exciting things to me, obviously, because I'm a surgeon, but also I think in breast cancer because I think a lot of what fed why women didn't get their diagnosis or awareness was not necessarily a popular thing before is because of the surgery. Historically, the type of surgery that was performed for breast cancer was very extensive. It removed a lot of tissue and unfortunately left a very poor cosmetic result. A lot of women who may have older relatives and have had this procedure can see a lot of deformity. That's what's in everybody's head. Thankfully today we have nothing like that at all. We are able in most cases to preserve the breast. We call that breast conservation, we call that lumpectomy. What we're basically saying is we're taking the tumor out with a little bit of the breast tissue and we're preserving the breast anatomy. In some cases it does become necessary to do a mastectomy or remove the entire breast. And even when we do that, we have such great reconstructive options that really from a cosmetic standpoint, you actually get a very, very nice result. More recently, we've been doing things such as sparing the nipple. Traditionally, we used to take the nipple, and in some cases, we can actually save the nipple so that you wouldn't even be able to tell this woman had a mastectomy. So thankfully, because reconstruction has come such a long way, we've gotten such great cosmetic results that even when you do a mastectomy, you can have such a nice cosmetic result. So surgery has progressed in a less invasive, as well as thinking about the entire individual.
Okay, let's talk about some situation, very difficult situation, sad situation, in case there is a metastasis, what we call metastasis, or the cancer spread, to other part of the body. What are the alternatives? What is the solution?
We have a number of solutions, and I think this is also why I have such a passion for this disease. At every step of the way, there is something to do. Breast cancer used to be mostly a surgical type of disease, and as we've moved along in breast science, we've basically started including many, many different team members. So now we include our medical oncologists, which are the ones that would, if the cancer cells spread, would consider possibly chemotherapy. And the reason I say consider, because there are some instances where you may use something like a hormonal therapy. So chemotherapy will be one of those main players, something that we can't access as a surgeon. We can take care of the local area, but if there are cells that contain cancer somewhere else outside the breast, then that's where the systemic therapy comes in, or the chemotherapy. We also, when we do breast conservation, consider radiation therapy options. At Maimonides, we have, as you mentioned before, one of the best cancer centers that there is, and the only cancer center in Brooklyn. And there, our radiation oncologists and our medical oncologists both treat patients that have this type of situation. And so it's important to know that there's not just one tool in our toolbox when it comes to fighting breast cancer. There's surgery, there's radiation, there's chemotherapy, and even within the chemotherapy realm, there's multiple different types of chemotherapy. And I always tell my patients that as long as we have a tool in our toolbox, we're good. And so there's many different ways to, even though it may seem like what we call, quote unquote, a sad situation, I actually don't see it that way. I see it as an opportunity, because we always have a tool in our toolbox.
As I mentioned before, I think prevention is the best medicine, and you may agree with me.
I agree.
And what are the different measure that the women can take to prevent or to decrease the risk of breast cancer? I'm talking about diet or any other measure that they can use to protect themselves.
I always say that the first measure is knowledge. Increasing your awareness about your body, increasing your awareness about knowing this disease is very treatable, and knowing what you're supposed to be doing on an annual basis to make sure we find this as early as possible. I think having that knowledge actually leads to earlier detection. With that said, I agree with you. Nutrition is a big role. I think when somebody eats well, they take care of the rest of their body as well. Everything just follows from that. I think it also comes down to exercising, having a daily exercise regimen. We all brush our teeth every day. We should all be exercising every day. And I think that that's also a very big help towards not only just physical health, but mental and spiritual health as well. And so I think these are factors that come in helping and prevent breast cancer. And even if you've been diagnosed with breast cancer, there's always a possibility of a potential recurrence. And so you always want to do the right things by your body, and those include the nutrition and exercise.
You know, I was going to ask you another very important question,
Sure.
but we are out of time. The importance of moral support, spiritual support to the patient of breast cancer, because I know that when we treat the body, we treat the complete, the person.
Yes, I definitely agree with that whole spiritual approach. And in fact, where the breast center is, the Maimonides Breast Center, has been designed in that fashion. It is the only breast center in Brooklyn. And it's been designed with a whole spa type of a feel to encourage that spiritual and wellness approach. You're not walking into a breast cancer center, you're walking into a breast health center. And the reason we have it that way is because we feel if we fix the spirit and the mind, the body will also follow. And so I think that whole spirituality is very, very important. I also believe increasing awareness is important. And that increased awareness comes from things like we're doing October 6th, the Ride to Live, where about 50 to 100 plus riders will ride from the Breast Cancer Center down to Sheepshead Bay, increasing awareness, again, adding to the knowledge of the community.
Let me ask you one thing, Doc.
Sure.
Very briefly, can you give your phone number and the phone number of the hospital in case of if the viewer want to follow up with you?
Sure. Our phone number at the Maimonides Breast Center is area code 718-765-2570.
Thank you very much.
It's my pleasure. Thank you for
having me.
having
And one
me.
more time,
Sure.
thank you.
Thank
from
you.
the bottom of my heart.
Thank you.
Thank you for taking time to come to this show, because this is so important. And as we said, prevention is the best medicine. Thank you very much. That's all the time that we have for these Brooklyn elected officials. Dr. Matheiu Eugene, and I would like to thank my guest, Dr. Manasseh, from Maimonides Medical Center, and thank you for watching Brooklyn Elected Official on the BRIC TV network. Thank you very much.
My
Doc.
pleasure.
I hope that
Watch this and other Brooklyn Independent Television episodes online at bricartsmedia.org/BIT.